Welcome back. I'm Teresa Harding, and I promised you that I would make a quick little video showing you a few little tips and tricks about breathing. We did the whole series on different things that you needed to know about breathing and what you can do about it and how it's affecting you and all of these things. So I wanted to give you these 5 little breathing tips that are maybe a little bit weird, some of them, but I am telling you, they are powerful and they will help you. The first one is when you have problems breathing through your nose. This is something that you can do. I actually learned this from a friend of mine who is an expert. She works at an office where they deal with respiratory issues and sinuses. And so what she taught me is that you put your tongue in between your teeth, you kind of clamp it, not like bite on your tongue, but it's like your tongue is not sticking out, but you suction on your tongue so that your tongue is kind of suctioned between basically your tongue is all the way to the roof of your mouth, top of the roof of your mouth, and as forward in your mouth as it can be without you biting on your tongue. So you put it up there and you close your teeth. And what happens is it doesn't allow your, when you snore, when you go like this and your tongue falls backward, like if you fall asleep on your back, if your tongue falls to the back of your mouth, it can make you snore. But so not only can you do this when you notice that you're snoring, and I'll talk about that in a minute because that's one of them, but if you will clamp your tongue in between your teeth like that, when you're exercising, I used to not be able to breathe in through my nose while I was exercising. It was just, I didn't feel like I could get enough air. But it's because my tongue was farther back and I didn't realize. Once she taught me that, and now when I do that, I work out hard. I'll do hardcore workouts. And when I notice I'm breathing through my mouth, I'll clamp my tongue like that. And I can breathe in and out through my nose for a long time without even noticing. And the reason you want to breathe through your nose is because your breathing through your nose does a lot of things. We've mentioned it in some of the other breathing videos, so I'm not going to go into great detail. I'll just remind you a little bit. It moistens the air. It catches a lot of the bacteria. So there are really important reasons that you need to breathe through your nose. The second little tip I want to give you is train yourself to sleep with your mouth shut. Now, this is where you can use that trick I just taught you, the first one, where you clamp your tongue in between your teeth. So, because if you snore, then it's because you're sleeping with your mouth open. And it can cause a lot of other problems with your teeth. It can cause dry mouth. It can cause dryness on your teeth, which when your teeth are moist, it helps them maintain the balance that they need so that they stay healthy and the enamel stays healthy. So this is a big deal. So what you do is you try to lay on your side when you sleep or in a comfortable position. And when you lay down, make sure that your neck is in line with your body so that you're not tilted, something weird. So adjust your pillow so that it's in line. So if you like to sleep on your back, great, but make sure your pillow is aligned so that your head, and what's weird is for your head to be aligned, people feel like it should be like that, but that's not aligned. Aligned is when you're like this, which means look how close my chin is, which means that your pillow would be pushing your head up, not like this, but a little bit. So just keep that in mind. And if you wake up in the night and you notice that you're snoring or your mouth is dry or something like that, turn into that position again, clamp your tongue in between your teeth like that, and get in a position where that is going to work for you. For me, it works to get on my side. I like to get on my side, but I need to put my pillow right here so that my head's not going like this, that it's right in between. Okay? The third thing is breathe through your nose when you exercise. Now, whether or not you need to clamp your tongue, a lot of people, when they exercise, they breathe in through their mouth. And for the same reasons we already mentioned, you want to breathe through your nose and breathe out through your mouth. And you can breathe out through your nose as well, but it's more important to breathe in through your nose. What's interesting is no matter what kind of exercise you're doing, if you will breathe properly, you get more oxygen into your muscles, which gives you more benefit. So the hard work you're doing, you get as much benefit as you can without wasting any of it. The fourth thing is breathing deeply into your diaphragm. Sometimes when I start to, I'm a lot more aware of my breath, especially over the last few years because I've been paying attention to that. And since I did this series with you, this playlist, and I notice it so much more often. And I'll notice when I'm breathing more shallowly, so I'll breathe into my diaphragm. You notice a little movement here, but you don't. When I'm not breathing through my diaphragm, this is what it looks like. I'm breathing into my chest. When I'm breathing through my diaphragm, it looks like this. And any activity you're trying to do, I don't care if it's exercise, I don't care if it's singing, any exercise, you will be able to get more oxygen and be able to do it at a higher intensity or at a better level of health. The fifth little tip that I wanted to share with you, it has to do with when you're breathing deeply. So let's say you're trying to do breathing exercises and you're breathing deeply. And if you feel like you're hyperventilating, which means you start to feel lightheaded, that I always thought that's just normal when you breathe deeply. No, that is not the case. I learned this from an expert breathing coach. When you breathe in and out deeply because you're trying to do breathing exercises or for whatever reason, let's say it's because you are exercising, then if you start to feel lightheaded, you feel like you're hyperventilating, then that is a sign that you are not breathing out enough of the air. You're keeping too much of the air inside. And when this breathing coach taught me this, because she was teaching us, this group of us, some breathing exercises, and I was doing them, and she said, if you're feeling lightheaded, when you breathe out, you think you've breathed all the way out and then breathe out a little bit more. And I thought, that's not possible because I'm breathing all the way out. And I was starting to feel lightheaded. Then I was focusing on what she said, and I breathed out. And when I thought I couldn't breathe out anymore, then I breathed out a little bit more, and I couldn't believe it. Within a couple of breaths, the lightheadedness went away, the hyperventilating was gone. So those are some tips that will help you as you are practicing your breathing. If you're doing this because you're practicing some of the things we've talked about in the other videos, or you're just more aware of it now, these are things that will be helpful. And I'll tell you what, the clamping your tongue thing, I use that in many situations now, and I can't believe what a big deal it is. Because she taught me this, when you are clamping your tongue between your teeth, you cannot snore. And you cannot block the airway as you're trying to breathe in through your nose when you're exercising or things like that. So it's great in a lot of situations. Try those things out, try to be aware, try to notice, and do those things, because I don't want you to just be healthy. I want you to be able to be better than healthy.